Things change. Technology advances our lives and towns grow, with people's expectations growing along with them, always with an eye toward a better future. The original Campbell County Memorial Hospital was built in 1953 and rebuilt from the ground up over 35 years ago. Campbell County Health now has the most comprehensive services in the whole state, with nearly 20 clinics in our medical group, the Legacy Living and Rehabilitation Center, and Powder River Surgery Center. We continually adapt to meet our patients' expectations, accommodate the latest technology, and respond to new trends in healthcare. That's why, when deciding how to best replace our patient rooms, we turn to those who understand caregiving the best: our doctors, nurses, technicians, aides, those who change the beds and serve the meals, and of course, our patients.
When I found out that the hospital was upgrading their rooms, I thought that was a great idea because I don't fit in the rooms very well.
Our daughter, who's 2.5 at the time, she was just crawling everywhere, just bouncing all over the place. And so it was pretty tight, to be honest, especially my family is from Rapid City, and so my mom was here a lot with me in the hospital so that I'd have somebody to be with me during the day. And it just, when doctors would come in, when Shay would come in, and Skylin would come, it was pretty tight.
Trying to maneuver in and around the sink and into the shower area, it was frustrating at times. That's why you're upgrading.
Yeah.
And so I'm excited to see where it goes and what comes of it.
You talk to any of the patients that have had an experience here, they can talk to you about how tight things get, especially after delivery. We're trying to keep moms and babies together as much as possible, but we're really limited in the space that we have. We would like for them to be together throughout the labor process, the birthing process, and postpartum. It is very obvious that we are not the most up-to-date unit, that other places have done more for the comfort of the family and just to provide not only space, we keep talking about space, but safety. But a pretty space is just a pretty space. We really needed functionality.
We took directors from the departments that would be affected and one other person, a staff member that does the work every day, and wanted to look at hospitals that had recently been upgraded to see what was out there, what was working, what didn't work. And then we involved our PFAC, our Patient Advisory Committee.
It's community members, diverse group of individuals that are not affiliated with the hospital directly. We're all there on a volunteer basis. From simple things of placement of light fixtures to televisions to flooring to wall coverings and things like that. Also the dynamics of the room and the logistics with regards to nursing care.
There was a lot of people that, they asked everyone from physicians down to the housekeeper. The rooms were designed around how it can affect the patient the best. And that was the goal of the whole deal, is putting the patient in the center.
We went to the smallest of details. So we talked about what are they doing when they're lying in bed and what do they look at when they're lying in the bed. Do they have a place to charge their phone? The bathroom was an important piece of it, not just about the size necessarily that was important, but the location of the bathroom. There's numerous studies out there that show that if a patient's lying in bed and they can't have a direct view of the bathroom, you have an increase of falls, and then in falls we have an increase of injury to our patients.
What I came to when I was here, there was no cardiac services, there wasn't renal or nephrology services. I look at a lot of the service lines that have been developed over those 17 years. If you're going to have those physicians, those specialties, you also have to have the equipment and the resources and the facility to support that. Every business, everything in town has changed. The community evolves, and part of that evolving of the community, you have to evolve the hospital, or else we can't do what we need to do effectively for the future for our community. It's just what we need to do.
Well, I'm very excited about this project. For one thing, it will be nice to have the facilities match the level of care that people are already receiving from the medical providers. But I think that there's been enough foresight and planning into this that this will certainly carry us into the future.
We are excited to make this positive change for you, our patients. By modernizing our patient rooms, we provide you with safer, more streamlined care. Best of all, we will have room to welcome you and your family to stay comfortably by your side. Construction has already started and will be completed in less than 2 years.